Well, a warm welcome to today's talk. Bit of a general global update today, really. Friday, the 18th of June. Now, just a bit of orientation on English-speaking countries, first of all, as we often do. Let's take a look at that. Well, Australia and New Zealand, of course. Canada, coming down really quite dramatically in Canada. And I believe they're mixing their RNA vaccines now. So if you've had Pfizer, you can have Moderna as a second one. I believe they're doing that now in Canada to try and help with the distribution. United States, flattish for a while, but now going down. Ireland, looking reasonably declining. But United Kingdom, well, there you go. That is what the Delta variant does. It's such a feeling of deja vu after the what we called the Kent variant, what's now called the Alpha variant. But I think there will be differences this time because of the more extensive vaccination programme. More on that in a minute. Now, we haven't got time to do everywhere in every video, obviously, but it was quite concerning trends really in South America. So there we have the United States at the bottom. Then Venezuela. I know the United States is not in South America, but it's the Americas. Venezuela, Peru, and then we've left on the UK by comparison where we said there's increasing cases. But if we look at some of these other countries here, Bolivia, Paraguay, Brazil, Chile, fairly high cases in Chile despite high vaccination numbers. Probably more on that later as well. Argentina, Colombia and Uruguay particularly high. So pandemic really is raging on in some parts of the world, unfortunately. Now a little more detail now on the UK to begin with, I think. Yeah, so here we are. This is the UK. So, and basically we notice the vaccinations aren't going as quick as we like, but they're going. Okay, it's reasonable. But people testing positive up by 33% on the week. Deaths. A low figure of deaths. I'm not sure we can read too much into that. 11 deaths in the last 24 hours. I mean, it's still 11 deaths, but it's way down on what it was. Patients admitted to hospital, though, up 41%. So this is related to the Delta variant, the one first identified in India. So Public Health England, Delta variant up by 33,630 since last week. Now the prevalence there is 75,953 cases of the Delta variant this week in England. And it's now 99% of sequenced genotyped cases across the country. I mean, wow. It has basically completely replaced all of the other variants. It has simply outcompeted them. And this is why I'm a bit concerned about the United States. We'll be seeing very encouraging data from the United States, but the Delta variant in the States is probably about 12% now. And it could well double in the next week to 10 days and double again and double again. So even though cases are going down in the States now, we could still see an increase in the States towards the end of summer, affecting unvaccinated people particularly, and it could be a problem in states, particularly in the South, Mississippi, for example, that I remember, and other Alabama, I think, where vaccination rates are really quite low. So it could be a bit of a issue there. But let's carry on with the UK for the time being. Now, Public Health England have said there's an increased risk of hospitalizations with Delta compared to the Alpha. They haven't put a figure on that, so we don't know quite how much. There's less people going into hospital now with the Delta wave because of vaccination, but in the raw state, the Delta variant is causing people to get sicker than the Alpha variant. And that's it. That is now fairly definitive. So as of the 14th of June, 806 people hospitalised with the Delta variant, up 423 since last week. Now, still relatively low numbers. I mean, if we look at this in context, so we see latest daily total there is 221 admissions. Just over 1,251 people actually in hospital as we speak. Now, this is perhaps 1% or so of the NHS's capacity. No one's saying this is a problem, but it's the direction that we're concerned about, and that is the people actually in hospital at the moment. So we do see a bit of an increase. And again, when we look at cases, if we look at this in context of where we have been, obviously it's nothing like, but it's the direction again which is concerning, as cases are starting to increase. That is the concern. So as of 14th of June, 806 hospitalised with Delta, up on last week. Of these 806, 527 were unvaccinated, and 84 of the 806 had received both doses of vaccine. So probably 10%ish of these had 2 doses of vaccine. Now this is indicating a degree of immune escape from the vaccine. So we certainly see that way more unvaccinated people than vaccinated people admitted, but this is I would say, not an insignificant number of people that have received both doses of vaccines being admitted to hospital. Now, we don't know the full details on these because of the patient confidentiality situation. We do believe most of them have got other risk factors. More on that will come out, I'm sure, over the next weeks. But there is definitely a degree of immune escape with the vaccines. Although overall, of course, the disjoining now between the number of people getting infected and the number of people being hospitalised and dying is quite significant with the vaccines. So there's a trickle certainly, but it's nothing like as bad as it would have been without the vaccination programme. Majority of Delta cases were confirmed less than 28 days ago. So as of now, the number of deaths are low. But of course, there's always like a month gap in the deaths. So how the deaths are going to increase as a result of the increase in cases and the increase in hospitalizations, really, we won't know for about another week or so. Dr. Jenny Harries, Chief Executive, UK Health Security Agency. Cases are rising rapidly across the country and the Delta variant is now dominant. Well, 99%, very much so. Primarily in younger age groups, primarily, not exclusively, primarily in younger age groups, a large proportion of which were unvaccinated. Please make sure you come forward to receive both doses of the vaccine as soon as you are eligible, she says. And don't drop your guard. Practice hands, face, space, fresh air all the time. So pleased to see that fresh air and ventilation is in there. Now, we have done this a couple of times, but I'm just going to go over it briefly because I think it's very important, and it's only just being picked up by the mainstream media now. But it's the change in presentation with the Delta variant, especially with more people being vaccinated. So it's very often, especially in younger people, more cold-like features. Headache, sore throat, runny nose, fever, cough, in that order. So most common, second most common, third, fourth, fifth clinical feature. Cough, of course, used to be high. And the loss of smell, you can't say no loss of smell, but it's much less common. So we see that a lot of these are more sort of mucosal symptoms, the runny noses, the sore throat is to an extent. It's changing. So the basic thing is to remember, have a high index of suspicion. If you get these symptoms, bear in mind that you could be passing the virus on to others who are more susceptible than you are. Now, quick look at the United States. The graphics are looking good there, but these don't show the increase in the Delta variant. So there could be some increase over the next weeks as the Delta variant becomes more dominant in the States, as it inevitably will. So cases looking downward. Deaths in the States, I mean, again, much lower, but still quite a lot of people dying in the day. 397 deaths, 7-day moving average 283. So but of course directions are looking good. Now in the States, cases are down 23.7% on the week, which is pretty excellent. Deaths down 31% on the week. Hospitalizations down 8.8. Positivity rates down to 1.9, indicating relatively low amounts of community prevalence, which of course is very encouraging. United States still has limited genomic testing, so we're not too sure about that. The latest vaccination for adults in the US is 65%, I think, from memory. Just looked at it recently. President Biden, of course, wants 70% for the 4th of July, and he's probably just going to miss that, unfortunately. Now, we've looked at Israel quite a few times because it's a very useful indicator of what happens in countries that are well vaccinated. So we see it there, but it's only actually about 60% of Israelis have had 2 doses. So it's not that good, and it's not going up dramatically quickly at the moment, but it is still leading the world. And then, so if we just check there, we started looking at that in December there with the increase in vaccinations. And then December there, the reduction in, just after that, the reduction in cases, looking good, and the reduction in deaths in Israel. So basically life in Israel's back to normal. It really is quite impressive. So looking at Israel, 7-day incidence 1.3 per 100,000 people. So very, very low. Now, the point I'm making here is Pfizer-BioNTech was the most common vaccine used, the mRNA vaccine, and the other mRNA vaccine, some Moderna, most with the Pfizer in Israel. Now, just before we go on to illustrate why I'm bringing this up, Israel sending 1.4 million doses to the West Bank Palestinian Authority, which I'm delighted to see. That is excellent. This is going to massively speed up the distribution of vaccine in the Palestinian West Bank territory. So they're talking about cooperative management of vaccine stocks. Now, I believe what's happening here is not quite as simple as it looks. I think the Israelis are sending a lot of vaccines to the Palestinian authorities in the West Bank, but they're getting some back later on as well, which, okay, it's basically described as cooperative management of vaccine stocks, which of course is always excellent. Israelis had already supplied healthcare workers in the Palestinian territories and 100,000 workers. So this is being advanced. And of this 1.4 million, we believe 100,000 doses have already arrived. And we do believe in the West Bank things are getting better. Don't know how that's going to be shared with Gaza at the moment, but West Bank-wise, it's looking much more encouraging. There's a lot more social activity and weddings and things going on. Now, Chile. Status of vaccination drive in Chile looks pretty good. So fully vaccinated 45.2, partly vaccinated 12.4, still waiting, not vaccinated. So, you know, that is looking pretty good in terms of vaccination in Chile. A bit behind Israel, but not massively behind Israel. But then if we look at the cases in Chile, well, it's not a good story. We're on about, 7,000 new cases a day. So it's actually going up again now. So cases actually on the increase in Chile, despite vaccines being rapidly rolled out. Now, what is going on here isn't entirely clear. But of course, in Israel, it was the Pfizer and the Moderna vaccine that they were given, and these are known to be highly effective vaccines. In Chile, most of the vaccine doses are Sinovac, which is an inactivated virus vaccine, Chinese produced. So it's the whole virus there. Now, I had expected these to be the best ones initially, but it turns out they're not having as good efficacy as the new mRNA vaccines. It still surprises me from an immunological point of view because they're giving the whole virus, so you'd expect a very polyclonal response, but the real world data is not as good, so it's the real world data that we go by. Now, they've also got something called the Brazilian Gamma variant in Chile as well, which is looking like it's more, well, it certainly is more transmissible. It's twice as infectious as the original virus. So a lot of this could be the effect. So my question is, to what degree is this reduced effectiveness of Sinovac vaccine, and to what effect is this the Brazilian Delta variant spreading in Chile? I don't think we can tell that at the moment, but we do know that's twice as infectious, so it's got to be a big part of it. Santiago intensive care units at capacity. There's a lot of pandemic fatigue, and with the high vaccination numbers, apparently there's a false sense of security. So it's going to be interesting to unpick the efficacy of the Sinovac vaccine in Chile compared to the efficacy of the Pfizer vaccine in Israel. We've seen the evidence in Israel. The pandemic's basically over in Israel. And hopefully most people will have immunity to the Delta variant, even if it did arrive in Israel. And there should be hopefully enough people vaccinated to stop that spreading. But in Chile, we don't know. So we do know that the efficacy of Sinovac is less than the Pfizer. It's had different levels of efficacy in different countries, but we do believe it's preventing most serious illness and death. But we now know that this gamma-type variant causes people to become sicker, and we do know that hospitals and ICU in Santiago are at capacity. So don't know the answer to that one yet. We'll watch that one with interest. Meanwhile, China are sending vaccines to a lot of places, 500,000, 500,000 doses of Sinovac to Malaysia, which is good. And China are also sending vaccines to Brazil. Now, President Bolsonaro seems to have had a bit of a personality transplant. He actually seems to be taking this pandemic seriously, which is good to know. He was calling it a little flu before, wasn't he? He was behaving somewhat, some might say, erratically. But he does seem to be taking it more seriously now, so you could say better late than never, although a lot of people have suffered in Brazil because of that and other factors in Brazil. There's been a lot of suffering and death in Brazil. So 60 million doses of the CanSino vaccine arriving in the second half of 2021. But it's $17 per dose, apparently, that the Brazilian government's paying. This is compared to $3 per dose for the Oxford AstraZeneca vaccine. So now I must say I'm immensely disappointed by this, because initially there was plans to make the Oxford AstraZeneca vaccine in large amounts in Brazil and to supply other parts of South America with that, but that just doesn't seem to have happened. So let's hope that the increase in vaccines from the G7 meeting starts to have a beneficial effect as well. And we know that the United States is going to be exporting Pfizer vaccine to South America pretty soon, but not as quick as the Chinese, it has to be said. Russia, things aren't particularly good. About 13,000, 14,000 new cases per day in Russia. We know the underreporting is rank in Russia. Moscow seems to be a bit of an epicenter, about getting on for 6,000 new cases in the day. And deaths, well, the reporting 396, but we really don't know. Federal Statistics Agency gives the total deaths at 270,000, as opposed to the official Johns Hopkins officially reported tracker at 127,000. So probably at least 100,000 on top of that. And things are still quite bad in Russia, especially in Moscow. So the mayor of Moscow, situation is described as dramatic in Moscow. There we are. 12,000 people currently hospitalised in Moscow. That is a lot of people. So healthcare facilities will definitely be very stretched in Moscow, unfortunately. Quite what's happening in terms of people being untreated, we don't know. There's not a lot of news that I'm aware of, certainly in the Western media. It would be good to get first-person reports from Russia, but of course there's complications with that. Good to see there's still no cases at all in North Korea. Case is 0, according to Kim Jong-un. But despite being no cases, he's told people to brace for extended COVID restrictions. So you can decide for yourself if those two things are consistent. And warns of food shortages. There seems to be a massive food shortage developing in North Korea. With the Chinese borders being largely closed and that being partly enforced from largely enforced from the Chinese side, the cross-border trade, black market, whatever you want to call it, is massively reduced, and there's a huge food shortage in North Korea now, so it's quite tragic. Another tragedy that country didn't need. Let's just get some food to these poor people in North Korea and worry about the politics afterwards would be my appeal. But other parts of the world still issues. Indonesia, for example, massive population in Indonesia, 270 million, around about 10,000 new cases per day at the moment, deaths up to 53,000. Strict social distancing measures in place, office capacities at 25%, Delta variant becoming dominant. Jakarta hospitals are already under stress, and because of the Delta variant, I'm afraid Indonesia could be in for really quite difficult times. So that's a quick review of various things around the world. I think we'll now get a video report from Ryan Aspinall, who's in Northern Ireland. So Ryan, thank you very much for sending that in.
Hello everyone, hello John. My name is Ryan Aspinall and I live in Northern Ireland. And hi, how are you? So a few days ago I emailed John, just giving him a few bits of information and data from Northern Ireland, because there hasn't really been much to come out of our wee country in terms of data from the entire UK. So I just thought it'd be fun and interesting for John to be able to see some actual data from Northern Ireland, considering there really isn't much out there in the popular press. So John has asked me to come on here and share some bits and pieces with you guys. So I hope you guys also find it interesting, and I hope it also shows that there is a little bit of a light at the end of the tunnel coming. Sorry, I couldn't get my words out there. So I'm going to start off with the Delta variant. Of course, it's very concerning. The spread has increased in the UK, and unfortunately it hasn't escaped Northern Ireland. We have had 28 cases of the Delta variant found through surge testing. Now, of course, that would suggest that there's community transmission. And of course, the area where the 28 cases were found is in a small seaside town called Kilkeel. There's a population there of about 6,000, and the health minister doesn't really know where the spread has come from. He doesn't know whether someone has travelled from a big city like Belfast or somewhere else in the north, or if they've come from the Republic of Ireland, say from like Dublin or Cork maybe. We just don't know where the spread is, but of course it is concerning because, as we know, the Delta variant can spread more easily. But again, it's one of the things where the surge testing identifies where they are, so hopefully we can stamp it out by getting the people who are infected to self-isolate. So our health minister has also said mask and social distancing will be around for a very long time in response to questions about how Northern Ireland is going to open up fully. Of course, Boris Johnson has had to delay the England reopening by 4 weeks. And usually in the past, Northern Ireland has followed England's restriction easing about 2 to 3 weeks after England has done it. So there hasn't really been many dates given by the health minister on when Northern Ireland will fully relax its restrictions. But a lot of people do estimate it may be 2 or 3 weeks after England fully reopens on July 19th next month, and that's if that does happen. But yeah, it probably will be about 2 to 3 weeks after. I think the health minister just likes to see how things turn out in England first, and then judging on the data and judging on how things work out there, that's when he will roll back the restrictions. Now, of course, I'm going to tell you some vaccine news, and it's great news. I noticed in a few videos ago, John has said, England was going to be ahead in the vaccine race, and then Scotland, Wales, and Northern Ireland would be a little bit behind. However, I can say Northern Ireland is well ahead. We have delivered, I think, 1.9 million doses thus far, and we have a population of 1.8 million people. So that is incredible, and it's an incredible achievement on behalf of our health service. And I can also confirm that I think all adults 18 and above have been able to get their vaccine from 2 weeks ago. So if you're 18 and above, you can book your vaccine appointment from 2 weeks and then receive it. I actually received my vaccine 3 weeks ago, so my age bracket, the 25 to the 30-year-olds, we can book ours 3 weeks. ago, and then a week after was then when the vaccine appointments opened up for every adult in Northern Ireland. So I got the Pfizer vaccine. Now, I had to go to the SSE Arena. It is a massive arena complex in Belfast, and I think it can usually hold around 5,000, 6,000 maybe, but it can hold quite a lot of people. So they've turned it into a massive vaccination centre, which is really well run, I must say. I received the Pfizer vaccine. Now, I have watched a few of John's videos talking about, some potential side effects relating to the Pfizer vaccine when given to young males under the age of 30. I, of course, am 27 years old, and to be honest, I wasn't really that concerned or worried about any, side effects related to my heart or anything. To be honest, a vaccine is a vaccine. I would take the Oxford AstraZeneca vaccine. I would probably take the Sinopharm vaccine. I would even take the Sputnik 5 vaccine. You know what? If our health regulatory service has approved the vaccine, then I'm all for it. And you know what? I love to travel. I love seeing my friends abroad. So if it means I get to achieve that at some point down the line, then I will honestly stick any vaccine in my arm and I will take it. I was actually really privileged actually to receive the vaccine. It just felt like a really great moment. But yes, I received the Pfizer vaccine. I'm just going to quickly go through some of the side effects that I did have. So I had nothing wrong with my heart, thankfully. But I did have a sore arm for about a day or two. Like, it did ease a little bit, but honestly, it just felt like, do you know when you go to the gym for the first time, or you exercise really hard for the first time, and the day after your muscles are just really tight and sore? It just felt like that, and that was all I experienced. I think I had a runny nose as well for like a day or two, but again, it was nothing that impacted my day-to-day activities. It was nothing that, made me want to cry or, made me feel like I need to go to the hospital or A&E or anything. It was quite manageable. I am a little bit nervous about my second dose because they do say that if you don't get it bad the first time, you're going to get it bad the second time. So, if John will have me back, I'm sure you'll learn all about my second vaccination. Hopefully it goes okay. Touch wood. Before I go, I'm just going to quickly give you some good data from Northern Ireland, and it is really good. So cases today, as of Wednesday, the 16th of June, I think there was 143 cases recorded out of 2,000 tests done. Now, of course, that is an increase. Most of the time we have been averaging about 70 to 100. But obviously, we do see a big increase there, and that probably is largely due to the Delta variant. But of course, one bit of really, really good news is Northern Ireland, for the past, I think it's coming up to 12 days now, we've had one death, which of course is really sad for the family, and any death or loss of life is really sad. But compared to where we were when we had upwards up to 100 people a day dying, it really is a massive improvement, and I think it shows the power of the vaccines and what the vaccinations are doing. And speaking of zero deaths, we also have 0 people in ICU wards, which again is an incredible achievement, and I think it really does show the power of the vaccines. And hopefully England and Scotland will soon be able to see data like this. It may take a little bit longer, but you know what? We do have a smaller population here. As I said, we have a population of 1.8 million people, so it's probably no surprise that the vaccines, we're seeing the vaccines working quicker here, because of course we do have the smaller size population. But again, as I said before, hopefully we'll see those cases in England, Scotland, and hospitalizations and ICU admissions reduced greatly after the second doses of the vaccines are given. So that is it from me. I hope you find this interesting. As I said, there isn't really much information out there about data from Northern Ireland, and I just thought it would be a fun idea just to share with John and share with you guys all the good news that is coming. As I said, hopefully countries around the world will begin to see similar things happen around them that has happened here. 0 ICU admissions, 1 death within 14 days. There is a light at the end of the tunnel, and I think the data from Northern Ireland definitely shows that. So, hopefully John will have me back for another report on how I find my second dose of the Pfizer vaccine. And I hope you all take care wherever you are, and I hope you all stay safe. And thank you, John, for having me on. Take care, guys, and I will hopefully see you next time. Bye!
There really is no substitute, is there, for people who are actually living in a particular area and experiencing it. So that's great. 1.9 million vaccines for a population of 1.8 million is going really well. And so pleased to see that disconnect between cases, hospitalizations, intensive care admissions and deaths is really becoming evident now in Northern Ireland. And having heard that, I actually feel quite encouraged, because it means it's more likely, in my mind, that is the way it's going to go in the rest of the United Kingdom and indeed in the rest of the world. So really nice to hear about that disconnect. And Ryan, of course, when you've had your second vaccine, please do come back on if people are still watching these videos. I'd still love to show everyone. And that is us for today. And thank you very much for watching.